It's important for patients to know, and I always tell my patients, don't eat for two. They want to know how much weight should I gain, and I think the most important thing is to not feel like I'm pregnant, I can eat whatever I want. Having extra weight gain in pregnancy can cause risk to the pregnancy, can lead to very large babies, gestational diabetes, and also can lead to difficulty with delivery. And it's good to get a balanced diet. You want to get proteins and carbohydrates. I always tell patients avoid a lot of extra sugar. So we do want patients to watch what they eat, not to diet during pregnancy, but don't eat for two. And there's certain foods that we want patients to avoid, like raw seafood, meats that aren't cooked well. Patients will ask about luncheon meat, if I can eat cold-cut deli meats or hot dogs, and those are okay as long as they're cooked. We get worried in pregnancy about a bacteria called Listeria. It's rare, but in pregnant women, they're more likely that they can get sick from that bacteria, so that's why there's all the caution about certain foods that you shouldn't eat. Patients ask, can I eat a turkey sandwich? And that's fine. We always recommend as long as it's heated well, then it's fine to eat. And it's very low chance they would get sick from that bacteria, but we just try to prevent any exposure to it. Cheeses, that's a common question patients have, what cheese can I eat? And anything that's pasteurized is fine. I have a lot of patients ask, can I eat the Mexican queso dip? And that is fine. It's important that they know they can eat melted cheese dip, but you want to avoid soft, crumbly cheeses. One is called queso fresco, which is I think where patients get confused about, but that's a white crumbly cheese that may not be pasteurized. So if they're at the grocery store picking up cheese to eat, make sure that the label says it's pasteurized milk. If you have any specific questions about foods that you need to avoid, we talk about that at your first prenatal visit. We go over diet, how much weight you should gain, and foods that you should avoid. Can eat fish during pregnancy. So fish is healthy. It has fatty acids and DHA that's important for the growing fetus and the brain development. So fish is important, but we want to limit it to about 2 to 3 portions a week, which would be about 12 ounces. Most of the common fish that patients eat are fine to eat: shrimp, salmon. You always want to eat fish that's well cooked. Fish that have more mercury are what we tell patients to avoid, so that includes shark, mackerel, swordfish, tilefish. Not the most common things that patients eat every day, but those are the ones they want to avoid. How much weight you should gain in pregnancy depends on where you're starting at. So a patient who's underweight obviously will need to gain more weight during the pregnancy, whereas a patient who's starting overweight needs to gain less. So in our practice, we discuss weight gain and where you're starting at the first visit so that you know how much weight you can gain. But it could vary anywhere from 10 to 12 pounds if you're starting as an obese patient. Underweight patients might need to gain anywhere from 15 to 40 pounds at the beginning of pregnancy. And that's something that really depends on your specific pregnancy, if you're having one baby or multiples, and that's something that you would discuss with your physician at the first visit. So what patients don't realize, if you're normal weight, average weight starting in pregnancy, you really only need about an extra 300 to 500 calories a day in addition to what you normally eat for the pregnancy. So that would be half a sandwich or a glass of skim milk. So it's really not a lot of extra calories that you need.